While some countries worry about a second wave of the coronavirus, many parts of the globe still have not seen the worst of the first outbreak yet. DW correspondents filed these coronavirus updates.
The peak of the pandemic in South Africa is yet to come. The country had a strict lockdown in the early stage of the pandemic to prepare the health sector. But although the lockdown has been relaxed, there's still a lot to do. Let me give you one example. If you're going for coronavirus test in South Africa at the moment, you will need up to 2 weeks until you get your results. This is why the authorities in the Western Cape here have decided you're only allowed to take a coronavirus test in public health facilities if you're above the age of 55 or have another disease and you have symptoms. By the end of the year, experts believe there could be up to 1 million coronavirus cases here in South Africa, and the authorities here in the Western Cape are considering adding another 800 beds in the conference center behind me.
India is overall coming out of the lockdown, but the coronavirus situation is worsening. For the past few days, we have been seeing a daily reported spike of over 9,000 cases. The public healthcare system is overstretched already. The death tally is also increasing. And while the government says that they are prepared enough, there have been multiple reports of people not being able to get tested on time or find a hospital bed on time. With the cases climbing every single day, it looks like the worst is not over yet for India.
I live around the corner from one of the largest hospitals in London in the UK, the big green building at the end of this road. At the height of the crisis, it seemed like the sirens never stopped, as hundreds and hundreds of patients were brought here in ambulances. Now it's much quieter. And yet, the UK has the highest death rate of coronavirus in Europe, and many people mistrust the government's handling of the crisis. So I'm not the only one who fears that there might be another spike, and that the sirens may once more be the dominating sound in my neighborhood.
The Nigerian government has continued to emphasize the use of face masks and other protective measures, but many people have become unconcerned about getting the virus and more interested in getting their lives and businesses back in order.
So when you look on the street, you see another person going on, no mask, no sanitizer, not keeping the necessary distance. It's scary. It's scary.
People are not staying safe because many people are still going out of the law. Some people are not wearing their face mask, and some of them, they don't even care. They don't even believe that there's coronavirus.
New Zealand's team of 5 million crushed COVID-19, but the celebration was short-lived as that very same team now faces a long road to economic recovery ahead.
Obviously, we have a lot of immediate issues to address: unemployment, international travel, and also just basically getting businesses back, small businesses, I mean.
I'm very hopeful that it won't take as long as some might anticipate, now that we are in level 1 and things are back to normal. But yeah, we're having the borders closed and things like that, it will make it a bit more trickier.
As we open our borders, that will be a real challenge, and often the tourism is what brings the money to the smaller centres, our rural areas, so I think that's going to impact them very strongly.
There is still around 8,000 new coronavirus infections in Russia every day, and restrictions are still in place in most regions across the country. But by lifting the lockdown in the capital, the authorities have given people across the country the sense that Russia has essentially beaten the virus.
The pandemic has driven a fault line through Brazilian society. Coronavirus infections are surging in the country, but President Jair Bolsonaro has repeatedly downplayed the gravity of the illness. He and his supporters want lockdowns lifted so economic activity can resume. Protesters are pushing back and mobilizing against Bolsonaro's handling of the country's massive outbreak.
The digging began before sunrise. Within hours, these activists had transformed Brazil's Copacabana beach into a shallow graveyard, a memorial to the country's 41,000 COVID-19 victims and a call to action. This pandemic allowed all of our social injustices and the incompetence of the public authorities to emerge. So we are here to ask for a change in attitude from the President of the Republic and the federal government as a whole. Throughout the crisis, far-right President Jair Bolsonaro has repeatedly flouted social distancing rules. At one point, joining an anti-lockdown rally. The group behind this protest say he has risked public health and left the country mired in death and division. Tension spilled out on the Rio seafront, with one man knocking down the installation. My son died from this virus at 25 years of age, and this guy is clowning around with no sense of respect for those who are protesting. There needs to be respect. The beach is public and protesters have rights too. Nobody tolerates that anymore. Causing terror. That's silliness, okay? The makeshift graveyard was meant to hammer home the human cost of this pandemic. In doing so, it exposed the deep rifts in a country polarised over its leadership.
It's to the Central African country of Cameroon now, and the story of how political rivalry is holding back the fight against the coronavirus. Prevention efforts are concentrated on the biggest city, Douala. Now, after a disputed election, the government has banned the work of the opposition leader, Maurice Kamto. But he and his party are determined to press ahead. DW's Blaise Ayong met some of the aid workers defying the ban.
These volunteers in Cameroon are getting ready to distribute COVID-19 prevention kits. They hand out face masks and alcohol-based hand sanitizers at the market in Douala, the country's largest city. Cameroon's opposition leader, Maurice Kamto, created the organization to help curb the spread of the coronavirus. People are happy to get the equipment, but authorities see it otherwise.
The government says this organization is illegal and their activities are unauthorized. This means the volunteers distributing these face masks can be arrested anytime by Cameroon security forces.
Since they started the program a month ago, at least a dozen people have been arrested across the country. Despite the risk, volunteers reach out to disadvantaged communities almost every day. 300,000 kits have been donated in over 15 communities so far. Vitalis Otia, a Cameroonian actor and a senior member of the team, says they are not backing down.
We are going to continue despite all the arrests, and we are continuing. They have arrested people in St. Malima, they arrested people in Kiosi. I was arrested in Boya, but here am I in Douala. I've distributed in Boya today, and I've come back, I've come to Douala, and I'll continue in Yaoundé, and I'll go back to Boya because the need is enormous, and we need to do our best. So there is no way to stop it.
Cameroon's interior minister, who banned the organization, was not available on our request for an interview. The new coronavirus is rapidly spreading in the country with more than 6,500 cases. Face masks were made compulsory in April. The opposition has continued to distribute hygiene kits to people who can't afford them.
I am so happy. I have spent much from my little savings to buy hand sanitizer, and I don't even have enough money to buy food, but I had to struggle to get the gel.
I'm now joined by Dr. Mary Stephen, who's working as a technical officer at the WHO regional office in Congo-Brazzaville. Good evening to you, Doctor. The WHO warned today that the pandemic is accelerating in Africa. Is the continent ready?
Yes, so we are seeing the outbreak evolving by the day on the continent. But this situation, if you look at the different countries, it varies from country to country. The pandemic is driven by 10 countries. Over 80% of these cases have been reported from 10 countries in the continent. So we still have some few countries that are reporting less than 100 cases, but we haven't seen the peak yet on the continent. And countries continue to enhance their preparedness and readiness capacities to respond to potential increasing number of cases. So we are seeing countries establishing community hospitals, trying to build capacity or enhance capacity at the lower levels of the health system. Because given the peculiarity of the systems in Africa, most of the capacities, you find them at the national level. But because of this potential of increasing number of cases, they are beginning to decentralize, to build capacity to be able to detect, to test, to isolate, treat, and also contact trace the people that might have been exposed to positive COVID cases, including the implementation of preventive measures among the members of the community. So the issue of hand washing, respiratory etiquette, maintaining the one, at least one distance, 1 meter distance away from others.
Dr. Stephen, I'm sorry to interrupt you there, but I do want to ask you this. We are still talking about Africa being the least affected region in the world. What is the explanation behind this?
Yes, Africa is the least affected region in terms of cases, in terms of deaths. So at the beginning of the outbreak, you will recall that Africa is the continent that had the importation of cases last. So we started having our COVID-19 cases by mid-February, when cases were reported across all continents of the world. So before then, countries were already implementing entry screening, and some of them were doing quarantine of travelers. So now, quite a good number of countries managed to detect those imported cases early enough. Some of them were picked at the point of entry. Some were picked from people that were in quarantine, mandatory quarantine, and they were able to limit the further spread of these cases in the communities. So in terms of the deaths, we also have a younger population and a low prevalence of the comorbidities that contributes to one's chances of dying. So these are some of the factors that affect both the cases and the number of deaths.
Very interesting, and thank you for that insight. That's Dr. Mary Stephen from the WHO in Congo, Brazzaville. Thank you. Ukraine is one of the few countries in the world where surrogacy is affordable and easy to arrange. But the global health emergency has prevented dozens of parents from joining their newborn children. The long wait has been painful for couples, but potentially disastrous for children's development. Now, some families have finally managed to be united. Our correspondent, Nick Connolly, met one such family.
1 month and 3 days late, but at least they're together. Pilar and Geraldus have travelled more than 10,000 kilometres by car through a continent in lockdown to finally meet their daughter.
She still has to get used to us. She doesn't know who we are.
Their daughter spent her first month with a carer in an apartment, her parents only able to see her on a screen.
It was so sad. We were crying, just seeing her pictures and unable to do anything for her. You just feel so helpless. All you can do is wait.
As their daughter's birth came and went, and with no end to lockdown in sight, all Pilar and Geraldus could do was scour the Ukrainian press with the help of a translation app, on the lookout for some sign of hope. Neither the Spanish government nor the Ukrainian embassy could or would help. When they read that Ukraine's human rights ombudswoman had promised to help parents enter the country, Pilar and Geraldus jumped in their car to drive the 3,600 kilometres from their home in Madrid to Kiev.
Our first trip was a leap in the dark. We didn't know what we'd encounter at the borders.
En route, they received the long-hoped-for permission to enter Ukraine.
We cried when we received this. I didn't think a piece of paper could make you this happy.
But it wasn't enough.
We'd passed all the checks and we're just 500 kilometers from Kiev. Then they told us no, we just couldn't take it anymore.
They were missing just one document, enough for them to be turned back at the Ukrainian border. Returning home to Madrid was the only option without their baby. A week later, they were back at the Ukrainian frontier after a 7,000-kilometer round trip to Madrid and back. this time with the right documents, and they were finally allowed into the country. Other parents have been less fortunate, separated from their children by even greater distances and still unable to enter Ukraine. How many babies are still without their parents, no one can say with any confidence.
We've lost months of our daughter's life. That's super important.
It was actually a month and 3 days.
To me, it felt like a year. Spanish must sound strange to her. She doesn't want to sleep. She just wants to listen to us. Now she's finally asleep.
Pilar and Geralda's journey to becoming a family like any other is not yet over. To register their daughter's birth in Spain, they'll probably still have to go to court. In Spain, as in many other European countries, surrogacy is a legal grey zone, neither legal nor illegal. The coronavirus lockdown was just the first of many obstacles on that path.
So we asked our correspondent Nick if it's known how many babies are still in limbo as a result of the lockdown.
We're all scratching our heads here trying to work that out, but it seems that even the government doesn't really know. So we heard from the Ukrainian government's human rights ombudswoman who'd helped families like Pilar and Geralda's to enter Ukraine with special permission. She says about 100 families have been in touch with her over recent weeks asking for help getting into the country while those travel restrictions are still in place. But experts say that is just the tip of the iceberg. They estimate that most agencies here in Ukraine have been advising their families to stay quiet, not to reach out to the government. They're worried about too much government intervention. There had been calls from certain lawmakers here to ban international surrogacy, so there was a real worry about coming out, as it were, and making clear quite how big a phenomenon this is. I think the pictures that went around the world of those babies in a hotel ballroom, they really aren't representative. That was essentially a PR stunt by a very savvy clinic director who wanted to get international attention to resolve this problem. Most babies, including Pilar and Geralda's baby, spent that first month, the last month or two, in a private apartment with a carer. So the picture, the reality, a bit more banal than those pictures. But this seriously is an industry that sees families from across the world coming to Ukraine. This is not just a European phenomenon. You have families from as far as Argentina, Saudi Arabia, China. Some of those Chinese families, it's estimated, have been up to 3 or 4 months late picking up their babies, given the lockdown started in China earlier than in Europe or North America. So this really is a global phenomenon happening here in Ukraine.